Americans have defeated their Trump, but here in Alberta, our Trump is still with us. Nowhere is that more evident than on COVID policy, and never has the likeness between our Premier and the defeated American President been more obvious. On Thursday, Premier Kenney gave the impression that he might finally move beyond saying, "Hey, knock it off, guys," to deal with the surging COVID cases in our province. But that's not what happened. What did he announce instead? A 2-week prohibition on some indoor recreational activities. Bars will be required to close a few hours earlier. People will have to space out a bit more in churches and other places of worship. And of course, there were more sound bites about freedom and personal responsibility. That was it. If that sounds weak and insufficient for the crisis facing our province, that's because it is weak and insufficient. Consider the context. In the spring, our public health authorities identified thresholds that would indicate when our hospitals were about to be overwhelmed. In the last week, those thresholds have been breached. We now have more than 8,500 active COVID cases in Alberta, 5,500 of which have been reported in the past week alone. The infection rate in our province is growing exponentially. The number of COVID patients in Alberta hospitals is now growing by more than 5% every day. 10 hospitals around the province are struggling with outbreaks. 3 long-term care facilities have more than 100 cases each, and another 47 have outbreaks. Province-wide, 73% of ICU beds set aside for COVID patients are filled. In Edmonton hospitals, we're at 130% of capacity. To top things off, an average of 6 Albertans are dying from COVID every day, and that average notches up every day. At the same time, the number of Albertans suffering from strokes, lung problems, kidney failure, and other serious long-term complications related to COVID is growing. Our contact tracing system has been overwhelmed, and our hospitals may soon follow. Premier Kenney said he would act when faced with a catastrophe. Well, a catastrophe is unfolding before our very eyes. But instead of action, all we get is Republican-inspired talking points and half measures. Sadly, it's not just our hospitals that are at risk. It's our schools and our workplaces too. As of yesterday, 653 Alberta schools have reported COVID cases. That's about a quarter of all schools in our province. 66 schools have had to close temporarily to deal with the fallout. Hundreds of others are teetering on the edge. At the same time, thousands of students, teachers, and school staff are isolating, some for their 3rd or 4th time since September. This obviously affects students and education workers, but it also impacts family members who may get infected by the virus or who may have to stay home from work with quarantined kids. As a parent, this is literally hitting home for me. 2 of the 3 schools that our kids go to currently have outbreaks. My old high school in Westlock, 100 kilometers north of Edmonton, has 200 kids in isolation out of a student body of 500. As a worker leader and representative, I'm also alarmed by the growing number of non-healthcare workplaces with outbreaks. There are outbreaks at Suncor Base Plant, Suncor Firebag, Syncrude Mildred Lake, CNRL Albion, CNRL Horizon, and the big IPL construction site northeast of Edmonton. There are also outbreaks at warehouses run by companies like Amazon, Purolator, and HelloFresh. Once again, there are also outbreaks at meatpacking plants like Harmony Beef and Maple Leaf Poultry, at manufacturing plants like Canada Bread, at retail operations like Superstore and Walmart, and at prisons and homeless shelters. The Premier says the problem is social gatherings, but the truth is we don't know where well over 60% of new cases were acquired. COVID is now everywhere. This is all so much worse than last spring. That's why, on behalf of the Alberta Federation of Labour, I'm supporting the call issued by Alberta doctors, nurses, healthcare workers, and health policy experts for a so-called circuit breaker lockdown to get the pandemic under control. I'm acutely aware that the Premier and his rabid issue managers will simply dismiss me, the AFL, and unions in general, as they always do. So don't just listen to me. Listen instead to our frontline healthcare workers who say we're already at capacity and that opening new beds won't help if we don't have people to staff them. Listen to our doctors who say ICU beds are already starting to become unavailable for people who get into car accidents or have heart attacks, strokes, or who develop serious infections. Listen to our nurses who say we're on the path to becoming the next Italy or New York. Listen to our teachers, education staff, and parents who say they're overwhelmed and terrified that our kids will become infected and that our education system will crack under the strain. Listen to our workers who say they can't afford to lose more hours to isolation. But don't stop there. Listen to the leaders from places like Germany and France and Britain and Ireland and dozens of other countries who are now taking tougher measures to address COVID with numbers that are often lower than ours. Listen to our neighbors and other Canadian provinces who are imposing stricter restrictions, also with lower COVID numbers than ours. Listen to the authors of a study published in The Lancet, the world's leading medical journal, who after surveying the experience with COVID policies around the world concluded that, and I quote, "The argument is strong for countries to adopt so-called zero COVID strategies which aim to eliminate domestic transmission, a notion which unfortunately our Premier has explicitly mocked." And if you're worried about the economy, listen to U of A epidemiologist Lenora Saxinger, who said, and I quote, "While we debate whether we should focus on lives or livelihoods, we are losing the opportunity to protect both." Listen to the experts at the IMF who, after surveying evidence from around the world, concluded last month that, and I quote, "Lockdowns impose short-term costs, but they lead to faster economic recovery, and that lasting economic recovery depends on resolving the health crisis." Listen to our friends from the Australian state of Victoria who, when confronted with a similar spike in COVID cases, opted for a sharp lockdown and are now recording 0 new cases and enjoying a fully reopened economy. Finally, listen to the renowned Boston Consulting Group, who provide economic advice to some of the biggest governments and corporations in the world. Last month, they released a report showing that policies that target zero COVID, again, the kind of policies that our Premier has mocked, would actually reduce the costs imposed on our economy by 30 to 40%. So what do we need that Jason Kenney and his government aren't currently giving us? Yes, we need the circuit breaker lockdown because the UCP's Republican-inspired do-nothing approach has left us with no other alternative. But that's really just the start. If we're going to have a lockdown to protect public health and restore the economy, then there has to be a torrent of relief for people to cover their costs of lost wages, to stop evictions, to support gig workers. We also need a province-wide mask mandate because masks work and clear rules drive compliance. We need the provincial government to stop its posturing and adopt the federal contact tracing app. We need mandatory paid sick leave, guaranteed by the Provincial Employment Standards Code, so people can actually afford to stay home when they're sick or when they need to isolate. We need dramatically increased funding for schools, so we can hire more staff to cover when other staff are isolating and to shrink class sizes to promote physical distancing. We need to heed the new scientific evidence on aerosol transmission of COVID and invest heavily in proper ventilation, especially in schools and workplaces. We need to follow the lead of British Columbia and start inspecting workplaces and fining employers who are putting their workers at risk by not following public health guidelines. The BC government has conducted more than 51,000 worksite inspections this year and issued 700 orders and tickets to employers. Here in Alberta, virtually no proactive COVID-related inspections have been done and no fines or penalties have been levied. How does it make sense that we fine people for speeding and not wearing seatbelts, but we don't fine employers for ignoring public safety orders during a pandemic? We also need to adopt the zero COVID crush and contain strategies adopted by the jurisdictions around the world that have been most successful at dealing with COVID, jurisdictions like New Zealand, and explicitly reject the do nothing, throw grandma under the bus strategies being used in many Republican American states. Finally, we need the government to use the period of a circuit breaker lockdown to do the work it didn't do over the past 7 months to build our province's capacity to keep infection rates low. That means investing far more in contact tracing. We need large complements of tracers when infection numbers are low, not when they spike and contact tracing is no longer possible. It also means providing support so people can actually isolate effectively. As I've said, that means we need paid sick leave, but it also means that we should look at things like institutional isolation facilities so the problem of spread within households can be addressed. Getting our COVID response right also means that our government needs to stop doing many of the things that are making things worse in our province. For example, they have to stop driving doctors out of the province. They have to stop their plans to lay off 11,000 frontline healthcare workers during a pandemic. And they most certainly have to scrap their plan to privatize our public lab and testing facilities. These services are one of the bright spots in our province's COVID response. And the UCP wants to bundle them up and sell them off to the highest bidder. This is the definition of insanity. The Premier and his toxic issue managers will no doubt listen to my message today and say that the AFL isn't standing up for workers or jobs. My response to that is that the Premier's Republican-inspired do-nothing approach is the real threat to jobs and the economy in our province. No one wants a lockdown, but the UCP has left us with little choice. A short, sharp lockdown of the kinds supported by experts and being implemented by governments around the world will mean we can get back to something closer to business as usual sooner. The economy will not thrive while the virus rages and people are sick and dying or afraid to go out. Pretending otherwise is both dishonest and reckless. The Premier says he's concerned about workers. Spare me. If he was really concerned about workers, he wouldn't be laying off so many of them during a pandemic and a recession. If he was really concerned about workers, he would support them through these tough times with things like paid sick leave and assistance with rent and mortgages. And if he was really concerned about workers, he'd actually address the rising numbers of COVID cases so working Albertans don't have to risk their health and their safety by going out into communities and workplaces with high infection rates. The bottom line is there will be no economic recovery until the virus is dealt with. There was an easier way to do this. That way involved investing in the things we need to keep infections low, like testing, tracing, and support for people in isolation. But our government didn't take that road. By downplaying the problem, behaving as if the pandemic was over, squandering precious time that should have been used for preparation for a second wave, and by engaging in austerity when we should have been investing in prevention, the UCP chose the hard way. In the United States, the pandemic is out of control largely because Donald Trump and dozens of Republican governors built their COVID non-policies around the false assumption that we have to choose between managing the pandemic and managing the economy. They chose nonsensical libertarian talking points about freedom and choice over common sense precautions to protect the public good. Jason Kenney has been using the same playbook as his Republican American counterparts, and we're all paying the price. I'm not holding my breath about Kenney having an epiphany and changing his approach, but I do have more confidence in my fellow Albertans. Let's remember who chose this road when it gets bumpier, as it inevitably will. And in the meantime, let's push back. You can do that on your own, or you can do it by signing up for our campaign to stand up to Kenney at www.standuptokenney.ca. Together, we can hold Jason Kenney accountable for his mismanagement of our province's response to the pandemic. And maybe, just maybe, we can pressure the government to acknowledge that with COVID, as with so many other things, it's better to follow the lead of Canadian provinces like BC rather than Republican states like Oklahoma. Thanks for listening.